We are going to dive in today and talk about something that is not talked about enough in fertility. Let's talk about the males and their part in it and the ownership. And girls, listen to this too. You can send to your partner if you're trying to get pregnant. If you want to donate sperm, the whole gamut. It is important to take care of yourself and to show up and to give yourself the best shot, literally possible. So we have Dr. Melissa Wenrich here today, and we're just going to dive in to this fun, exciting conversation. Let's do it.
The goal here is to learn how to treat your mind and body like a professional athlete. Welcome to Mind Your Body. I'm Dr. Audra Lance. I'm a doctor of chiropractic who specializes in treating sports and non-surgical injuries. Anything that involves muscles and joints. I treat big-name celebrities and professional athletes. Most of my patients refer to me as the witch doctor because they can't explain any other way their pain was removed that quickly. I hate cooking, but I do love wine, and don't even think about giving me anything that involves ketchup because I will not eat it. Every episode of this show is designed to help you move better, live better, and feel better. Now let's go do this thing.
Hello, butthole breathers. I am so excited for our guest today, Dr. Melissa Winrich. And we are going to be talking about something that we both think is not talked about or addressed enough that we see in our clinics. And we're going to dive in. And it's with fertility, the men. We need to be talking about the men and how they need to show up, what can be done to help, part of that process. And there's no one better than Dr. Melissa, who's with us because she works with the couple and both of them. And she has some tips, tricks, things she wants you to know if you're trying to get pregnant, if you're having difficulty getting pregnant, if you don't even know if you want a kid yet, but you want to just learn more. And I know all the girls, you're going to be listening to this and then writing down pieces for your partner, or you could just send this to them and they could listen to it themselves. So welcome.
Thanks for having me. This is going to be so good because, like I said, no one wants to talk about this. Mm-hmm. And, it's enough as is that we're getting women's health facts out in the world. I mean, we're still behind on that. Women are lost in their journeys. But I think a part of that comes to we're not addressing 50% of the issue, right? And just this intimacy and this we need support, we need to feel love, we need to feel sexy, we need to feel all these things to have a healthy baby. And part of that is it's our partner and how we feel. And I'm so glad that we're talking about this because it is a much needed conversation and it has really transformed my practice to incorporate the guys into the conversation.
Yes, we all need to go. It just can't be so much pressure and stress on one person. So, jumping right into it then, it is not sexy to be like, hey, I'm ovulating. Let's bang one out here, right? There's so much pressure if you're struggling, if you're not struggling, if you're, we're on birth control in this day and age, women for 10, 15, 20 years. And then all of a sudden we're like, okay, I want to get off next month and get pregnant. And we're shocked when that doesn't happen and feel like something's wrong with us. And, 3 months in, it's okay, I need to go spend 30 grand on IVF or more. So let's just start in the beginning there. Because I feel like that is the problem that you see online, that we see in our clinics. And there's so much we can unpack from there from both sides.
Absolutely. And that could, this is days of talk around this because number one, we were not taught. Let's go back to the beginning. We were not taught as girls the side effects, what would happen to our bodies, how we would be shut down from the brain down to the ovaries, down to our womb creative center. And, you're having a few little feelings. Let me just fix it by band-aiding your hormones, which is our superpower. That is our superpower as women. So here we are going through that years, maybe a decade or more on these pills or just, throw in the environmental toxins in our food and everything else that we're bombarded with environmentally. Now we're sitting on our butts. We're not, right? It's just like, we're just hit with a lot of things. I mean, it is like, it's coming at us from all directions. And then, you wake up and you're like, oh, I want to have a baby. Do you think, and your OB's like, just get off birth control. It's not a big deal. When you have your period again, you can start trying. And it's like, no. Because fertility for me, it is a vital sign. It is a vital sign. You should want to be having sex. You should be ovulating. You should feel fabulous in your body. Also, your male partner should not have any issues having sex, ejaculation, whatever. Like, he should be feeling great. He should have muscle. All of these things should be happening before you want to start trying to have a baby. And so I think my biggest take home, it's like I said this to my husband the other day. I was like, if anything happens in my lifetime, this is like the one fact that I want people to understand is whether or not you want to have a baby or not, like your fertility should be through the roof. Like your vibrancy as a man, as a woman should be through the roof, because that's how we operate. That's how we're going to feel good. If we're, we don't want to have our hormones in the tank and feel like crap all the time. So that's the biggest thing. And we just need to go back. We need to have this period of preparing. We prepare for so many other things. And this just gets like, oh, if you're having a period, just keep trying. And even to the point of, oh, we can keep trying for 6 months. Oh, you had a miscarriage. Oh, well, we can't really do anything about it until there's been 3. That, you treat women that have had miscarriage. This is traumatic. This is not something we wait until something is wrong.
Right.
And so that's why just the more education we can get out there of like these little things that can be checked, right? Like these little factors that are our foundation of our health, So.
And you hit on it a little bit, but for everyone listening, specifically, let's talk about the male.
Yeah.
What are some things that you are like, everyone should know? If you don't have bam, 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 let's dive into this deeper conversation.
Yeah. So number one, let's just talk about, are you waking up feeling good? Do you have energy? Like there are a lot of things we don't need to go spend a bunch of money on. I am all for labs. That is part of what I look at. That is part of the picture. But I can tell when a guy walks in my door if they're vibrant or not. Like you can tell. What's their posture? Do they have muscle mass on them? We both need to have muscle mass. Like what's the glutes and what's the biceps look like, right? Like, if we have those things going, like metabolic health is probably going to be, somewhat good. I'm not saying labs are going to be perfect,
right?
But we need good metabolic health because that is just part of the hormone cascade, right? We need good cholesterol to make good testosterone, to have good cortisol. Are they getting sleep, right? Like that's a big thing for the guys I see. And just, and so much in Nashville. We're in Nashville. It's the music city. My husband included, it's like the circadian rhythm of touring musicians is non-existent. No. And so, they kind of, that's their work. Everybody else that's home at night has zero excuse. Like get in the bed, get sleep. Like that. I mean, that's our cortisol, that's our melatonin, and that's how we make our sex hormones. And so it is super important. We're not sitting on screens every night. The other thing that is just absolutely integral is, do we have any like low back pain, any lower abdominal issues going on? Because that is where all the nerves, the blood flow, the circulation, that is a big, big part of the female and the male workup that I do is, do we have circulation in the pelvis? Because if we don't, there's probably going to be an issue with blood supply, circulation. The other thing is like, we don't want sperm sitting there for too long. Like it kind of turns to shit, like we need things like moving. We don't need to, the whole thing of no nut November is like it's like the worst thing that guys can do because we need this semen to be healthy. And we need these things to like be working. And it is a thing. It's like, if we don't use it, we do lose it. And that's with working out. And I know you're big on that. And it's just like, we can't just sit around and do nothing. So, metabolic health, sleep hygiene, eating food, eating enough protein and fat. Like, sorry guys, like we cannot be vegetarian and expect to have good testosterone. It's not, there is no way. I honestly, I'm not saying I won't work with people, but I will get them to eat meat. Like, cause it's just, we're going to hit an uphill battle. And then I'm going to get blamed for, oh, you didn't help me feel better. And I'm just like, you're living on lettuce. Like, this is not going to work, you know? So what were you going to say about that?
I was going to say, I mean, you and I have been in practice for a while now, and like, you know, we do our own case studies at the office and patients we see.
Yes.
I stand by that for all patients. Like,
yes,
the more pain, the more stress, the sicker they are, the more metabolic issues. And then we come back to, what are you eating? Vegetarian or vegan? It's just your body. We are meant to have good sources of protein and red meat.
All the red meat, the red meat. And that's the biggest thing too. That is one thing, if you just cannot, like, it's just not a thing that you can do. But like, if you were going to bring a child and grow another human, like, this is not about you anymore. This is not about you. We need to make sure that we have the best possible DNA, the best possible egg, sperm health. I mean, this is going in to make a human and set them up for the rest of their life. We know now with studies, when both parents are metabolically busted, which over 95% of Americans are right now, the kid is going to have more likelihood to have diabetes, metabolic health issues. Like, we're setting them up for failure from the second that they're born. And that is not okay. You know, like, that is not okay. So we have enough stuff coming at us in this modern world that we live in, and just, you know, to do everything we can on the preconception side of things. You know, in my functional neurology background, one of my first classes I did was in childhood developmental issues, and just being able to dive in and really find the root cause to help these kids. And the biggest way to prevent, you know, this epidemic we're in with sick children, especially when it comes to brain and developmental issues, it is the preconception period, because it is what mom's doing. It is what dad's doing. And I just, like, I cannot stress that enough. And it's like, if you don't even think you're going to have a baby in the next, you know, year, continue doing your health things. Take care of yourself. Because those patients of mine that came to me and said, I don't even have a partner yet, Dr. Melissa, but I want to be healthy. I want to be well. I know I want to be a mother one day. Those girls are, when they get ready to get pregnant, they are not having issues, because they're showing up in that partnerhood to, like, they're searching out for a guy that's willing to do the work, willing to make the changes and be healthy. And that's what it's what it should be. And I know it's hard. I know it's hard to make changes, because lifestyle is, it's the hardest. We'd rather pop a pill or take a supplement or do all the things, which is a time and place for those. But it comes down to these lifestyle issues. And another big one for guys is the drinking and smoking, whatever it is. We have too much data. Too much data. At least stop while you're trying, and 3 to 6 months before. Like, get your sperm healthy. Get your sperm healthy. You know, that's your choice if you want to go back doing that. After, like, you have given your gift of sperm. But, like, we have too many chromosomal things that are popping up with, you know, with chronic weed, alcohol use. Those two biggies are not good.
And yeah, let's dive into that too. Because for everyone listening, they might be like, what are you guys talking about the sperm? Like, the quality, the mobility, motility.
Yes.
Why is that so important? And what is the purpose of that?
Right. Well, we need sperm. Sperm is like how we get, you know, into the egg. And they are, like, fighting for their life. Like, the best sperm. Just imagine. I mean, it really is. It's like you have this golden egg in front of you. And every month they're like, who's going to get in? I mean, they are, like, you know, getting through. And only a few get through. So we need motility. Motility is like how well those little guys are moving. And so if they're not moving very much, we're not gonna penetrate the egg. Like, it's just, you know, they're gonna get tired. Imagine if, like, you're out in the pool and everybody's having a swimming contest. I mean, if you have a bunch of people that aren't active and haven't been exercising, it's not going to look very pretty. Like, people are going to be, like, taking breaks and flipping on their back and doing all the things. And then the other part of this is the morphology. And that's where it comes down to these chromosomal. Like, do we have the head of the sperm needs to be able to penetrate the egg? And so things that cause early miscarriages are usually these DNA fragmentation and chromosomal issues in the sperm, which comes down to like, does it have more than one head? Does the sperm even have a head on it? Like, there's just a lot of factors. And that's what happens when you get a semen analysis, if that is part of your workup, at a fertility clinic. And we even do those for our patients that, that walk in and aren't even going to the fertility clinic. But I will send the guy out for a semen analysis, especially if someone's had multiple miscarriages or if we know that there's been a health issue in the past with the male partner. And so we have the motility, which is the movement, morphology, which is how it looks, and the shape, because we need that shape to actually be able to get it to attach and get into the egg. And then the other thing is just how much sperm do we have to begin with? That's the big one. It's like, if there's not a whole lot there, we're not going to have a good chance of pregnancy even happening and fertilization for even happening. So those are the big things. The cool thing is that sperm can change in like 64-ish days. So if guys get on it, start making changes, the radical improvement that I see. I just talked to a patient of mine yesterday that just got hurt. We're working. He was military. The military guys have been through a lot, and we don't see very good assays, semen analysis on them. And so we've been doing work. They've been doing work. He's super metabolically fit. Everything else is perfect. It's just we're working on some of these things. His motility doubled.
Wow.
Just from doing making lifestyle changes. And then we did do some detoxification strategies with him, improving, antioxidants, things like that. But it's just really neat when you sit back and see how our bodies can heal.
Yeah.
If we make very specific changes to just improve our overall vitality. And that goes for male and female, both. I see the changes in both. And it's just every day I'm like, this is a miracle. And this job that we get to do is so cool.
I know. I'm so grateful for it every day. And like you were saying earlier on, it doesn't have to be these huge, 180 lifestyle changes. It can be one or two things that, like you said, in 64 days, you're going to see a difference. And it doesn't, I think sometimes people are scared to come see us because they're like, I am just not able to, walk around in the forest all day. I'm going to have to work, and it's like, well, we don't have to do that. We can pick one or two things that have the most bang for your buck of, okay, listen, we can change this. And I think that goes for anything. And that's how we operate in both of our practices. What about for males when they're like, is there any way I can look at my sperm and tell if it's good quality or not? Is there any texture, color? Is there anything from your standpoint that you've seen in the past, or have you had that question before? Because some of these, people are too scared to ask themselves. So I'm going to ask it for them. Right.
And thank goodness for that, because I feel like that's the thing and sometimes people don't even know what to ask, because what if something has been their normal?
Right.
And I say this, no one knows how bad they feel until there's improvement 100%. Because we get used to our norm and that goes for everything. That goes for with women with, I've always had cramps at my period. I thought that was normal. Or right. And so I think the biggest thing obviously are the big things. We don't want to see blood. We don't want to see, a lot of times with infection, you'll see, just very viscous, super, super stagnant, or even chunks. Kind of it's kind of that same thing of period. We don't want to see clots. We don't want to see, we want easy flow. Obviously there's a reason that ejaculate is sticky. It has to get in there. We want to get, everything's getting in there and moving. And while we get pregnant when we're ovulating, because what does our fluid look like, right? It grabs it and, we have to have that. And so I think that's important questions. A lot of the things that we don't see, most of the guys, it's going to look normal. And then there could be a problem. I think the biggest thing's really the only thing you'll rule out is STDs, a serious infection. Another thing that I just want to bring up is a lot of guys don't know, because it goes without symptoms, is there can be just a little blockage or anything. And there can be just some things, and that's going to be just on exam. If you've exhausted everything, or you think that the male partner is like, there's nothing, like she is completely healthy. She's ovulating. She has the best labs. She has, everything looks good. So really diving into the anatomy and, maybe sending that guy out to a urologist just to get checked for some different things is going to be really, really good for him, because it could be an easy fix, It could be an easy fix. And that could have been the problem all along.
Right.
And if we're not talking and asking about the guy,
Yep.
she's going to think it's all her fault for the last 3 years. Right.
Yep. And let's talk about that. Even if I just feel like even people who are like, okay, we're going to try, it's just already so much pressure on the relationship it needs to happen this month. Like, how are you having those conversations with your couples of how to mitigate that stress and pressure?
Well, I mean, one of the first things that I do, which is, part of we are hands-on. We are hands-on practitioners. Thank goodness. It's such a power tool, right? Like to be able to do that, but just really getting them back connected, like getting them both back connected, getting, the woman back connected to her womb, like getting back into the body, because usually by the time I work with couples, they have had years of infertility, or maybe we have already been through a lot of traumatic things. So it's kind of already at the point of like, we're going to try, but we really just need to take a break because just the relationship has taken a toll.
It's exhausting.
And it's exhausting. And every month you're wondering like, oh my gosh, did my body do this? Oh no, it didn't.
And then shame hits.
It hits the second they don't see that positive test. And it's a lot to carry. So that's why so much of this work, and why I don't just do the labs and say, okay, we're going to stay very scientific on this. We have to do the work in the body. We have to be connected. We have to get back to, okay, what are our steps of how we want to feel? May the gift of all of this be another life, right? But I want both people to feel so good. I want them to feel vibrant. I want them to be steady and really kind of taking it out of the equation of like, just can we take some of this pressure off and have fun? I mean, sometimes I'm not kidding. My prescription for my patients is, I need you guys to go on a fun date. What did you used to do? Like, what did you do when you guys met? And so I had one that I sent them to play skee ball and go to the arcade one night. Like, just go do fun things.
Yeah.
Like, get to know each other, date each other. Because a lot of times these couples have been together for a while. And, you have that on top of the infertility or chronic health issues. It's just anything can bring a lot of stress. To the couple. So yeah, I think the intimacy work, which is really cool that there's more people out there in the world doing this, of like, okay, we have this badass couple. They're both doing this amazing work. I tend to, see women that are late 30s, 40, they have this amazing career, or, and vice versa. Like both partners are incredible entrepreneurs and they're on their laptops all night, right? Like it's almost like, well, I need to do this instead of let's turn everything off and focus on each other for a little bit.
And right. I mean, going on those date nights and stuff, as you have a neurology specialty, like that changes your brain chemistry, which also alters your cortisol, which helps your hormones. I mean, it just all snowballs. Having fun can be the prescription for a lot of things. Right. And I think we make it harder. I think that's the biggest thing is we get so tied up in the latest thing. And I'm not against the latest things. Sometimes the latest things are groundbreaking in healthcare. I'm all for it. But we can't just sit here and wait for that when we have all of these things at our disposal that most of them are free or very low cost. And that can change your entire life. Like get in the sun, get outside, go on walks, go on runs, whatever you like to do as far as movement, lift your weights outside, eat as many of your meals as you can outside, like get some of this metabolic circadian rhythm thing in check. And I promise, like, come back to me, do it for 60 days. And if you don't see any shifts, like I will pay someone, like it is like, because I know it's going to work. I know it's going to work. So simple, but it's so powerful. And
it is.
I was wondering, like, there's someone out there listening and they're like, okay, this is a lot, but this is so good and so juicy and so yummy. What Tell me some cases like that you've seen of couples. Take me through maybe part of their appointments, or what does their prescription look like, and how long, just maybe some different case scenarios you've seen in the past couple months.
Yeah. Okay. So first off, it's time. We cannot do this in 1 or 2 visits.
Mm-hmm.
It's just not going to happen because we're making lifelong lifestyle changes. We are making foundational changes to both partners. Like, we are kind of overhauling a step-by-step approach, not to get overwhelmed, because that is, I had a call with one of my patients today, and I'm like, is this too much? She's like, no, this is good. But what are we focusing on the next 30 days?
Right.
So I always there is a timeline. And this is kind of whenever I used to treat a lot of traumatic brain injuries and concussions, this is what you have to do. It is low and slow. And I follow that no matter really what's going on with the person sitting in front of me. It is low and slow because we need to figure out also, there is a time and place for all of it. But what does this person across from you need right now the most?
Mm-hmm. Mm-hmm.
And it might be that we need to address, like you said, the shame, or if there's anxiety around this, or we've dropped into just severe grief and we don't even know if this can happen for us anymore. Mm-hmm. And so that might be where we start, right? And so that might be a big part of a lot of body work on the front end. We might be doing all the womb healing, acupuncture, like the in-person hands-on thing before we even do labs. Mm-hmm. Mm-hmm. And so my last one, that's what we did, because she had some things done. And I'm like, you know what? We're pushing pause on numbers and diagnoses and all these things that are outside of you. Mm-hmm. And we are going to start with what's inside and getting you back connected to that. Mm-hmm. Because from a place of nervous system regulation, a place of calm, a place of trusting body again. Because for so many, I know with so many of you listening, you don't trust your body anymore. You feel like your body has abandoned you. Mm-hmm. Mm-hmm. And it hasn't. Mm-hmm. It's just no one has figured out these foundational pieces because they haven't opened up to a book and found all your story and your experiences in a diagnosis code. We are not a number.
No.
And we are not broken. And whatever the body is doing for a purpose. Number one, to keep us alive. Right? I mean, that is really what it is. We're here to procreate and thrive. I mean, that's basically very primitive. And if for some reason we can't procreate, there's something going on that our body is keeping us alive for. Mm-hmm. And so just returning to that power, that's one of my, that's who I was talking to today. It's we're returning to that power. And then once they feel good in their body, I'm going to pull the labs. I'm going to pull and see, okay, now that we're in the body and we feel calm, we're sleeping through the night. We're moving every day outside. We're eating breakfast. Mm-hmm. Basics, y'all. It doesn't take, it is not rocket science. It's we can't go till 1 p.m. just drinking coffee. Mm-hmm. So, eating breakfast. Then let's dive in and see what that insulin's doing. Let's see what your blood sugar's been doing the last few months. Mm-hmm. Let's check leptin. Let's see what, let's check your inflammatory markers, because I don't want to go in and start making changes if we need to make changes when it comes to food, or if we need to add supplements or do very specific, detoxification things. If someone's so outside of their body, it's going to be another chore for them. And we want this to be from a place of thriving and a place of I'm doing this because I feel good in my body about this. Mm-hmm. So that's one of them is we do that's why I'm so individualized. There is no protocol to this. Mm-mm, mm-mm. And then I might have someone
too.
It is
fun. Everyone's so different. It's we get to create and dance and make up a whole thing just for you based on what you present with and what you say and what you tell us and everything.
Mm-hmm. And so that's one aspect, because it's the minute we think, oh, I'm going to do labs day one and do this and that's all me and all ego, you're not going to get anywhere. You're going to screw up. You're going to make someone feel like shit because you detox them too fast. It's not going to go well. And so that's one. And then the other couple that I just recently, that's on my mind that I've seen this week is, he had a vasectomy. And so I see a lot of couples where we are getting we are getting the female like all ready because they will have to do some sort of reproductive endocrinology. Like we will have to go to a fertility clinic, right? Like this is not going to happen at home. So we've got to get things lined up for, like I help them get like their consults lined up for reproductive endocrinologists, like get him as healthy as we can, because there's going to be procedures involved whenever a couple wants to have a baby, and there's been a vasectomy. So that's the other side of this. I get quite a few, I know it sounds like there's quite a few people that have that because they may have been previously married, chose to have the vasectomy, and now they're with a new partner and they want to have a family together. And so that's the other thing. So for that person, like I'm diving right in with that guy. Like we are getting labs, we've got to be robust because we have a few things up against us. Right. And so I want them to be more than optimal when it comes time to do, the IVF process, because, it's a lot. It's a lot on the body. And then also for the female, I work with a lot of women that are going through IVF. A lot of them end up not having to do IVF because they get so healthy and they don't need it anymore and are able to have a baby on their own. But for those cases, like obviously they're going to have to go through that. So we just get as healthy as possible, get ready for, all the hormones and all the things that go along with that are hard on the body, but we want to walk into that really, really healthy and vibrant. So that's the other case where it's like, we may have to work a little harder on the guy and making sure that he's staying on par with all the lifestyle things and supplementation and just getting sperm as healthy as possible.
And take me through an ideal timeline. So hey, I'm like, okay, I heard you. We kind of want to start talking about it, maybe start trying. I'm going to, walk outside, lift weights, go to sleep, help my nervous system, just try to dive in, focusing on as healthy. This is guy and girl. And it's been going on for X amount of time. When do I see you? Or do I go straight to IVF? Like paint that picture and that roadmap for me.
Okay. Usually I say, so most of the couples I work with, 3 months is minimum. And that's just because we know, what did I just, like 64 days for sperm. It takes like 3 to 4 months for women, for our egg quality. And I'm working with women that are, in quotations, we're getting called geriatric. I had my babe at 39, geriatric. I was definitely healthier at 39 than I was at 29. So, there's a whole debate about that. Most of the women I work with, that's what we get to, right? Like we're going to be healthier now than we were 10 years ago. And so we're going to walk in, and if they're ready, and we're like, okay, how much time can you give me? We're going to go ahead day one, do a full workup. I usually spend a couple of hours on that first visit because we're diving in on everything. I'm looking at, past labs, past, anything that they're bringing to me, we're going over. And then we'll just dive right in. Usually if it's hey, I've got 3 to 6 months and that's all I can do, we're going to go ahead and order labs and see where that couple is. Because if they're ready, the last thing I don't want them to have, like if it's a miscarriage, like I don't want them to have another miscarriage before I check labs, right? Because there may be something. And more than likely, there was something that was missed because a functional lab panel that I do is much more comprehensive than they're getting at their OBGYN.
Absolutely.
Or their PCP, unless they're trained specifically in hormones and fertility and looking at more of a root cause approach. And so I'm looking to see at that point, is there anything we need to hyper focus on? Right. And so, and we may need to do that. If, progesterone's low, if I don't think they're ovulating, if we have prediabetes on the board, right? Like we've got some changes to make. And so that's usually part of it because unfortunately I'm not getting young couples in saying, I think I want to have a baby in 5 years. If we're looking at that, we can make these lifestyle changes and okay, come to me a year before, let's do some labs and we'll make sure everybody looks good. So typically it's the 3 to 6 month thing where we are going to pull functional labs, and then we're going to make changes very specifically to each of those partners, right? We're going to make sure everybody's getting addressed what needs to be addressed. And then they're coming in for body work. And so I do acupuncture, I do womb healing, we do a lot of visceral work, just like you, I'm a chiropractor. And so we are working to bring circulation, blood flow, and reconnection to both partners. So we're doing that part. We may do functional neurology if we have one of the partners, specifically the female, if she has been on, ADHD medicine or things that she has been on medication wise for several years, we may try to, get her brain functioning. So then she and her medical doctor can make a decision about that. Mm-hmm. So that might be a part of the picture. So really it's stepping back and doing a lot, and it sounds like a lot, but it's very specific to what this person needs. And so, someone may just need more of the womb healing because they've had 3 abdominal surgeries, mm-hmm. right? So if they've had, a lot of scar tissue and we don't have the circulation, that's where we're spending most of our time. But it's going to be a 3 to 6 month change because I need to see changes in those blood labs. There's no point in, doing one set of labs and then not making the changes and not doing the work. And I used to do that. I used to do the one-off appointments. Mm-hmm. I'll see you. We just don't do that anymore because I need to see a transformation. Right. I need to see this couple go from, I don't feel great, I have no energy, no sex drive, to I feel so good in my body. Mm-hmm. Mm-hmm. That's what I want to see. That's what I'm here for. And that's what I want to see in both in the partners. So it's really fun to see that, and just really fun to get people that are just ready to do the work because they want to feel good. Mm-hmm.
Mm-hmm. And I mean, we both know so many times all it takes is that, and you can prevent IVF. But there are cases, of course, where IVF is needed for different circumstances, mm-hmm. and doing all this stuff. And you can speak to this too and maybe tell a couple stories. But this is also going to support that. And it's we get it. We're not always opposed to it, but why don't, for anything, why don't you start least invasive to most invasive for your body to process?
Yes. Well, that is it. So I love how, we've been in practice for a long time. I'm over 19 years in practice. And so still standing. And so it has come a long way. Mm-hmm. Back when I first started, I was very high volume, but I remember one of my first patients that came to me and said, Dr. Melissa, my husband and I have been trying to get pregnant for, I think at that point it had been 3 to 4 years. And this was 16 years ago, or 15 years ago. And I said, let's go, anti-inflammatory diet, very basic, not taking, just no gluten, no dairy. Let's get adjusted and let me do some acupuncture. It used to be that easy. We are up against a lot now. So now it's I wish it were that easy. It's just people would get pregnant, And so over the years, I've had to learn a lot more. We have a lot more, we have a lot more on the table now. Mm-hmm. People are waiting until they're older to get pregnant. And mm-hmm. yeah. And so I just think that's the biggest, one of the biggest things. But the IVF piece, I have so many cool stories. It's they come to me, they want to have you, we have 1 embryo left. And I'm okay, we're going to do everything. And some of these girls have chronic health issues. They've had previous, surgeries, whether that's autoimmune conditions, things like that, of why they were told they needed IVF to begin with. Mm-hmm. The calls I get, especially early on in the pandemic when everything was shut down, the calls I would get you're not going to believe this, Dr. Melissa. I'm what? She goes, I'm pregnant. I'm pregnant on my own. Mm-hmm. We just had sex. I don't even know what's happening. I've never been pregnant. I was told I could not get pregnant. And it's it's because you've done the work. And at that point, a lot of these girls, especially for IVF, when you have 1 to 2 embryos on the line, and that's that is their last chance, or what they have been told is their last chance to be a parent, they're working and doing these lifestyle changes for 6 months, a year, sometimes longer, because they want everything to be as perfect as they can get it. Mm-hmm. But 4 of the last babies of 2 of the girls that were, the ones that were really told that would never happen. There's 4 babies that happened without IVF. I'll just say that, and that's just, we have so many stories of that. And just the other thing with IVF, if we do need to do that, I cannot stress the importance. I wish I had a study, and we need to do this study because we know the visceral work improves, acupuncture alone improves. But what happens when we combine all this, like what we do? I'm just like, I'm combining all of it. I'm doing we're putting all of it in there.
Yeah.
I don't like to fail, and I don't, and and I can't make promises, but most of the time, if both partners are doing the work, the outcomes are pretty great. And we're just going to have a better chance. We're going to have a better chance, whether that is going down the road of IVF or if it's a natural pregnancy, right? Like it is whatever the route is, we just want to be as healthy and as vibrant. We want both people to be as healthy and vibrant and taking responsibility, because it's being conscious about this and bringing life into the world. It's just so much more than that positive test, because we want this babe to thrive. We want this babe to be healthy. And I think that's the piece that gets missed a lot, is we forget about the emotion side of it, because everything is so sterile in our Western medical system, and it is sacred. And when we step back and truly take that responsibility, because this is just the start. We need to be healthy. If you're having a baby at 40, I will tell you firsthand, you better be healthy before the baby gets here. Because it is like, you better be lifting your weights. You better be doing your stuff, because, I want to be running. I want to lift, he's 45, 50 pounds now. And it's like, he wants to be a kettlebell sometimes. So I'm throwing him through my legs and throwing him up. It's like, we have to be able to live our life and have fun and play with these kids we're having. And so it's such a bigger picture than just showing up at the doctor's office and saying, okay, just stop taking your pill. You'll be fine once you start your period. And it's so much deeper than that. Yeah. So much deeper.
Absolutely. And you've hit on this the whole time, but if you haven't listened close enough, it is both. It's not you just go to the appointment by yourself. It is both parties come and have this conversation and do this work. And if I'm sitting here, like, how am I going to convince my husband to come? Or how do I ask, because you're already probably stressed. You're worried. Both parties are on edge. You're kind of like, oh, we're only having the quick, try to have a baby sex, because it's just a hard topic that we see all the time. And how do you recommend people having this conversation of are we ready? Let's do this together.
Well, and I think that's it. We're just, maybe it's midlife, but we're here for a snippet. Life is so, we are here for a snippet. Have the hard conversations. If you can't have the hard conversations right now and have your sovereignty over your body, it is going to be hell trying to get through parenting and standing up for your child, because you are going to get a lot of voices coming at you and a lot of questioning from everyone in society. And so just start it. Have the conversations. It may be a hard conversation, but I promise if both parties want the same thing, it's going to bring you so much closer together. And that's what I see, because it's just, you're avoiding the hurtful talk. You're avoiding the tears. You're avoiding what both people really want. And if both people really do want it, I've had that happen before too.
Yeah.
And it's not just the guy, it's the woman. She comes in, she goes, now that we've done this womb work,
yeah,
I don't want this.
And that's okay too.
And that is good. I want people to know what they want and what they don't want.
Right.
And to be able to stand up for themselves and trust our body and be able to have those discussions. But, I think the biggest thing is we're up against a lot, but it doesn't have to be hard. We can make just easy lifestyle changes. And we're never going to regret those. Those lifestyle changes, we're never going to regret that, because we're just going to feel better. And maybe, that's what we get out of it. But I promise you're going to make some type of shift. So talk to your partner, especially, as the girls, we're usually the ones that push the health in our whole household. We're the ones that bring it in, because we're the medicine women. And just have that conversation. Just say, I want this to work. I want this to work. And as a woman, we are the ones doing we are the ones carrying the baby for 9 months. We are the ones, we're going to be breastfeeding. We're going to be doing all these things. And so, the guys can, you guys can show up and I know, and they want to show up. They just haven't been taught how. And, if you're a guy listening to this, like there are ways to show up and find support and do the things that you need to do to feel better in your body, because, you want to be able to be the dad these kids are looking up to. Having this healthy masculine and healthy feminine is just so important in raising kids. And so, yeah, I think that's.
And what's the most common question you get from the guy when they're coming in and they're like getting introduced to this work?
I mean, usually it's like what they have to cut out, because they know what they have to cut out. Well, just because like fancy whiskey is a cool thing, right? Like there's just things that society and fun and going out, and I'm not saying you never can do that, but when we're in the trenches of like, we've got to get things healthy, what is it like, what are the things that I can do? And usually they're willing to do it. They're willing to do it because we can do something. We can do hard things for a few months. We can do hard things, and usually once they do that, like they feel so much better. They've probably made a pretty big shift long term for the rest, for the foreseeable future. And so that's the biggest thing, is they don't really know where to start, because there's just a lot of mixed messages. It's, take the, if they're already working out, then they're, what about the crappy pre-workout stuff they're doing? Like all these things that marketing is so beautiful and very catchy. A lot of those things are really, really harmful, for sperm and egg. Right. So, I think just having somebody to be able to go through and look at all the things, what foods, what supplements are you taking? A lot of times it's more of stop doing things and adding good rather than cutting out food groups. Does that make sense? Like it doesn't have to be hard. Yeah. It doesn't have to be hard or uncomfortable.
Right. And I mean, you're never going to regret investing in your health.
Never.
Ever. No matter how much money it is always going to pay off in dividends down the road. Like you're never going to regret that. So many people are like, what's the cost? What's this? And it's like, at some things, you get the purse, you get the fancy car, and you're kind of like, I don't feel anything. Well, you're never going to regret feeling good and putting yourself first and prioritizing that. Right?
Right. And when you have health, like you're unstoppable. Like I guarantee you, your career is going to improve. You're going to make more money when you're having better sex, when you are like, have more muscle on you, feeling better in your body. Like I want you to feel good, like not be bloated and being, beating yourself up, like all these things, right? Like people should feel good doing this. And it's just an effect that's going to keep going. And it's just really beautiful to see that, because then it affects, their friend groups, and they're talking about like, what are you guys doing? You guys are looking really good, and it just, that's how we change the world. And it's very, it's so cool.
And I feel like we are changing medicine. I feel medicine changing. People are craving the time with their doctor. They're craving that teamwork of like, let's go through this together. Like, and it's just so fun to see. And I know you see it on a daily basis too. And if you're listening to this, Dr. Melissa is taking couples. She's taking patients. She has a bunch of ways to work with her on a variety of things. And just even her Instagram offers free advice. So we're going to link all that stuff in the show notes for you. And if you have any questions, you can directly either reach out to me and I will connect you with her, or just hop on her Instagram and send her a DM. Like we're in the service industry trying to help people. We are more than happy to help you.
Yes, that is what we're here for.
Yeah. Is there any last key words or something you want to say that just like as a reminder, like what is your mic drop?
Right. The biggest thing is, no matter where you are, if you have had years of medical mismanagement, not feeling supported, number one, you are not broken. Your body is working exactly the way your body needs to work right now. Like our body prioritizes. Our body sends us messages. It's not, oh, I'm broken over here, fix this, do this. They're simply messages. And we need to learn how to hear those and to listen to them, and just returning back inward, because so much of this is we're grasping for everything outside of us. And once we realize we have it all, we just may need some support from Dr. Audra, from myself, from this team approach. And I think that's what the future of medicine is you are supported and you don't have to do this alone. You do not have to do this alone because it's not something that should be done alone.
No.
And it should be talked about and your story should be heard. And your story is the same as a lot of other couples. I promise you it is because I hear them. So reach out for support. Make sure that you're feeling heard in your appointments, no matter what is going on with you, because being seen it offers powerful medicine to be seen and heard.
Oh, yes. Oh, that gave me goosebumps. What a good mic drop. I love it. Thank you so much for taking time out of your busy schedule to come hang out and chat. And I just appreciate it so much.
Oh, I appreciate everything you're doing. Thank you.
Thank you.
Now, if you want to do something really special for me and got a lot out of this episode, go leave a 5-star written review of the show on Apple Podcast. And if you're a Spotify listener, just tap the 5 stars. To submit any of your health questions to the show, simply DM me on Instagram at Dr. Audra Lance. And don't worry, all your questions will be kept strictly anonymous. So send me all your embarrassing questions. And don't forget, breathe into your butthole. Toodaloo!